Don't know if we can start. Okay, I think let's start. Good afternoon to you all, distinguished guests, colleagues, fellow advocates for maternal and newborn health. I am Professor Maureen Musia, a midwifery lecturer from the University of Pretoria, from South Africa, and also the co-chair of the Nursing Now Committee, Africa Hub Lead. I will be the program director for today. I am here with Dr. Sanele Lukele and Ms. Zipporah from the African Hub. Today, as we gather here to commemorate the International Day of the Midwife, we join a global movement led by the International Confederation of Midwives under a powerful and urgent theme that says 1 million more midwives. This theme is not just a number, it is a call for action, a call to invest, to train, to support, and to retain midwives across the world. Because we know that when midwives are present, skilled and empowered women are safer, babies survive, and communities thrive. So happy International Day of the Midwife to you all midwives across the globe, more especially to you all from the African region. Please make use of the chat and just tell us where are you connecting from, and happy International Day of the Midwives. Without further ado, today is a special day and we are having amongst our midst early career midwives, researchers, global leaders within the midwifery profession, and we are so happy, we are so excited to have you join us in our webinar. I think we will start with our program. We'll have the words of welcome from Dr. Sanele Lukele. She is a senior lecturer from the University of Free State, South Africa, and also the Nursing Now committee from the African Hub. Dr. Sanele, over to you to give a word of welcome to the midwives.
Um, Thank you so much, Prof. Musi. Thank you so much. Afternoon, colleagues, distinguished guests, and members of the midwifery community across Africa and beyond. It is my great pleasure as co-chair of the Nursing Now Challenge Africa Hub to warmly welcome you to today's webinar as we come together to mark the International Day of Midwife. It is a moment of reflection, celebration, and renewed commitment to the critical role midwives play in strengthening health systems and improving maternal and newborn outcomes. Today's program brings together, as Prof. Musi said, voices of leadership, expertise, and lived experiences. We are honored to be joined in absentia. We are honored to have a video from the IEM president, Dr. Sandra Torres, who will deliver our opening remarks also. And we also look forward to an insightful keynote address by Dr. Jemima Dennis Antwi, who will speak on the urgent and important topic of retaining a midwifery workforce in Africa. Importantly, we will also hear directly from the field through the lived experiences of Ms. Harriet Naiga, who reminds us that behind every policy and strategy are real people, real stories, and real impact. As we engage today, I encourage each of you to listen actively and reflect deeply and consider how we can collectively advance the midwifery profession on our continent. We also look forward to hearing from a group that I am so proud to be part of, the Midwives in Focus, and from Dr. Sally Pizarro as well as Ms. Gila Zabif will be talking to us about the important work of Midwives in Focus. Thank you so much for joining us, and I wish you a meaningful and engaging session. Welcome, everybody. Thank you.
Thank you. Thank you so much, um, Dr. Samuel Lukele. I think every midwife, we are all feeling welcomed. Uh, Let us move to the ICM. Let us hear from the ICM president, Dr. Sandra Torres, giving us an opening remarks from the International Confederation of Midwives. Over to you.
Hello, dear colleagues. Hello, dear friends. Today I speak to you not only as the president of the International Confederation of Midwives, but also as a colleague, as a midwife, as someone who has witnessed time and time again the profound difference that midwives make in the lives of women, newborns, gender diverse people, and families. It is an honor for me to join you today for the International Day of the Midwife, and to connect with colleagues all across Africa, a region that continues to inspire the world with its strength, with its resilience and leadership. Midwives are there at the very beginning of life, in moments of joy and in moments of vulnerability. They bring not only clinical expertise, but humanity, dignity, and trust. And yet today I speak to you with both pride and a deep concern, because we're facing a global crisis right now across the world. We're missing nearly 1 million midwives. This affects more than 180 countries around the world, representing the majority of women of reproductive age worldwide. And the burden is not equally distributed. In Africa, for example, the number of midwives that we need to increase will be to 2 to 3 times just to meet the current needs. And in the Americas, up to 85% of the needs for care is still not being met. Behind these numbers, there are real lives. Women who give birth without support, newborns who do not receive essential care, families who face preventable loss, and different situations regarding sexual and reproductive health and rights. But on the other hand, I also speak to you with hope, because we know what is the solution. We know the solution, and it's based on evidence. When midwives are educated, supported, and empowered, they can prevent around 2/3 of maternal and newborn deaths and stillbirth. And even a small increase in coverage could save more than 1 million lives every year. This is why at ICM we have launched the 1 Million More campaign, a global call to grow, to support, and sustain the midwifery workforce worldwide. This is not just a regular campaign, it is a movement. It is a movement for equity. It is a movement for health rights and sexual and reproductive rights, a movement for life. And Africa is at the heart of this movement, because midwives here are already leading change, often in the most complicated and challenging situations, bringing care where it's really needed. Imagine a world and what could be possible if every midwife was fully supported, respected, and enabled to work to their potential, to the full scope of practice. It would be totally different, yeah? So today, I really invite you not only to celebrate our day, but to act. Sign the petition, raise your voice, and advocate in your communities, in your institutions, with your leaders. Because together, we can build a world where every woman has access to a midwife and every midwife is able to provide care for what they're trained for in the best conditions. So I would really like you to leave you with this in your minds and in your hearts. Midwives do not only bring life into the world, they protect it, they honor it, and they transform it. So when we invest in midwives, we are not only investing in saving lives, we are shaping the future of humanity. So let us make that future one where no woman stands alone, where every birth is safe, where every voice is heard, and where every midwife is valued. Because some changes began quietly, and we know that as midwives, in the hands of a midwife, and grow into a better world for all of us. Thank you very much to each one of you for your wonderful work, and happy IDM 2026.
Wow. Ladies and gentlemen, midwives from across Africa, I think we have heard from our ICM president saying that we midwives from the African region, we are the backbone of the maternal and newborn care. This is a call for us to join the movement for equity, the movement for life. Africa is at the center of this movement. Thank you, thank you, thank you so much, Dr. Torres, for such words of upliftment. Today's webinar, as we've indicated, we will be looking at a way forward, retaining the midwifery workforce in Africa. What does that require? And ladies and gentlemen, allow me to call upon our keynote speaker, Dr. Jemima Dennis Antwi, who will be telling us more about how do we retain the midwifery workforce in Africa, looking specifically at the challenges, the opportunities that we can look at in terms of the African region. Dr. Jemima, over to you.
Thank you very much, Madam Chair, for this opportunity. I would like to say good morning, good afternoon, good evening, wherever we are, distinguished colleagues, midwives, nurses, partners, and our stakeholders across Africa and the diaspora. I am indeed honored to be part of our celebration of the International Day of the Midwife. Let me, however, begin by expressing my sincere appreciation to the organizers of the Nursing Now Challenge Africa Hub for this kind invitation and for their continued commitment to strengthening nursing and midwifery workforce across our continent. Dear colleagues, today is truly our day, a moment to celebrate each other for our immense and selfless contribution to society. We honor each other for educating competent and compassionate midwives, for providing life-saving clinical care, developing policies that guide standards and practice, regulating education and professional conduct, advocating for improved maternal and newborn experiences, investing in the health of women, newborn, and families, as well as serving within communities to ensure continuity of care. Colleagues, all these efforts converge together into one shared goal. That is ensuring that no woman loses her life while giving birth, and that every newborn has a chance not only to survive, but to thrive. As one anonymous quote beautifully captures, midwives hold the hands of women and the future of nations at the same time. Again, midwives do not just deliver babies, they deliver hope, strength, and new beginnings. This year, colleagues, marks the 35th anniversary of the International Day of the Midwife, when it was first launched by the International Confederation of Midwives. The global theme for this year is 1 million more midwives. And this is both a rallying call and a stark reminder. But we must ask ourselves, where are the midwives in Africa to save lives? Evidence from the World Health Organization, the United Nations Population Fund, and partners show that Africa bears nearly half of the global midwifery shortage, despite having less than 20% of the world's women of reproductive age. Again, 9 in 10 African women in Africa live in countries with insufficient midwives. The continent has only about 41% of its midwives needed. And sadly, each year, Africa records approximately 196 maternal deaths and 1 million newborn deaths. Health workforce density continues to stand at less than 1.55 to 1,000 population, which is far below the 4.45 threshold required for universal health coverage. This is not merely a shortage. It is a systemic workforce crisis, one that affects survival, deepens inequities, and undermines the quality and dignity of care, as earlier mentioned by the ICM president. Over the past decade, significant investments have been made in midwifery education across Africa, Madam Chairman. We are producing midwives who are competent and capable of delivering up to 90% of essential maternal and newborn health services if they are supported. And yet, the central challenge remains: we are not retaining our midwives. Retention is not simply about numbers, remember. It is about conditions, it is about recognition, and it is about sustainability. There are a number of challenges that I would like to mention. Number 1, poor working conditions. As we may know, midwives often work in under-resourced facilities with inadequate staffing, limited equipment, and overwhelming workloads, leading to burnout and dissatisfaction. Number 2, there is inadequate remuneration and incentives to midwives. There is low pay and limited incentives drive both internal and external migration, often into environments where African midwives face under-recognition and inequity. The third point I'd like to mention is limited career progression. A lack of clear pathways for specialization, leadership, and academic advancement reduces motivation and long-term commitment, with some leaving the profession of midwifery. There's lack of respect and supportive supervision, in that despite critical role, many midwives operate in systems where their voices are not heard and their contributions undervalued. We also have an issue of safety concerns and emotional burden. And this is due to exposure to trauma, fear of litigation from affected families, and unsafe working environments. And these take a significant toll on the mental health and well-being of the African midwife. However, we are glad that there are opportunities for transformation. In spite of these challenges, there are powerful windows of opportunity before us that we as midwives and allies of midwives can explore and can also exploit. The first is looking at investing in the next generation. And I must say that it is heartwarming to see quite a number of young midwives in attendance today at our webinar. Africa has a young and dynamic midwifery workforce. Initiatives such as the Nursing Now Challenge, Africa Hub, the ICM mentorship programs, and the Global 1 Million More Midwife campaign provide platforms where young midwives can play roles in leadership, mentorship, and advocacy. Number two, we have the opportunity of strengthening midwifery education and innovation. We must continue advancing competency-based education whilst integrating emerging fields such as digital health, genomics, climate and humanitarian health, health policy, and systems modeling, so that as midwives, we ourselves can model the gaps, identify the solutions, and offer direction to our governments. Number three, we need to look at expanding higher education and leadership. Midwives must be supported to pursue advanced education and take their rightful place at the decision-making table so that their voices are not muted in decisions that affect the mother and the newborn. The fourth point I would like to reiterate is building policy and investment momentum. Madam Chair and colleagues, as governments and partners increasingly recognize that investing in midwives is one of the most cost-effective strategies to reduce maternal and newborn health and mortality, we need to take advantage of the situation and to ask for our quota in attention. And we must speak to these effects. We need to also promote the midwifery models of care, which is midwife-led, community-based, and team-oriented models improve outcomes. These reduce workloads, pressures, and also enhance job satisfaction. The sixth point I would like to make is on strengthening data and workforce planning. We are glad that periodically the State of the Midwives report is released. The last one which was released is 2021. And it is encouraging to note that beyond the World State of the World's Midwifery report, countries and regions have taken the initiative to also organize their section of the data gathering or the evidence. And I'm proud to say that in Africa, we have had Southern Africa and also the West and Central Africa also gather the evidence to indicate the situation of the state of the African midwives. Now, I'd like to say kudos to our colleagues. We need to get more midwives involved to look at robust data systems and workforce modeling, which are essential to address inequities in distribution, especially in rural and underserved communities. And at this point, I would like to urge all midwives, as we look at higher education, maybe it's time to diversify. Do we necessarily have to do first degree in midwifery, second degree in midwifery, third degree in midwifery? We need to look at how do we bring ourselves to a diverge, but at the same time, stay within the focus where we can sit and speak for midwifery. We need, therefore, to consider that as we celebrate today, it is also the opportunity for us to act. We must lead a call for action and commit to investing in education at all levels to produce specialists and researchers. We must support regional initiatives such as the Pan-African Midwives Alliance, which is PAMA, born out of a Unifying Midwifery in Africa initiative, of which I'm glad to be a co-convener. We need to ensure safe and enabling work environments. We need to provide fair remuneration and rural incentives for those who voluntarily put themselves forth to work in the rural community. We need to look at creating clear career pathways and leadership opportunities to encourage our midwives to seek for higher education so that we do not just stay still and therefore remove ourselves from the decision-making table. There's also the need for us to strengthen supportive supervision and professional recognition of our own. Those who do well, we must commend. We must also put ourselves in a situation where we can quietly reprimand and help those who are not faring better to do better. We are able to do this as a collective. We need also to focus on prioritizing mental health and well-being for our midwives. And I'm glad that in recent times, maternal mental health is becoming an important area of concern and for which there is growing investment into making sure that this is addressed. I would like to say that we need to look at the midwife also, her mental health in providing for the mother and her newborn. Madam Chair, colleagues, let us remember that retention is not optional. It is a health system imperative and a matter of social justice. We need 1 million more midwives. Of this 1 million midwives, we need over 41% to be returned to Africa. Africa needs to retain its midwives as they are produced, as they are recruited, as they are posted, as they are deployed. Africa must maintain its own. And Africa must put in place the resources, must put in place the leadership, must advocate, must be willing to actually put forth its leaders, its midwives to succeed. For as a midwife succeed, so does the mother and her newborn in Africa. Today, we celebrate not only the works of midwives, but the lives they save and the future they shape. We are alive because a midwife dared to be at our birth. Let us continue holding the torch high. Let us burn the candle by not putting the candle under a chair, but putting it high on the pedestal so that our lights will shine forth across the countries, across the communities, across families, and above all, across the world. Let us move beyond celebration to commitment, investment, and action. Thank you very much for your attention and for your unwavering support. Thank you.
Wow. Fellow midwives, can we please give Dr. Jemima a round of applause? Thank you, thank you, thank you, thank you so much for such beautiful words that, if I can reiterate with the quote that you gave us to say, midwife hold the hands of women and are the future. And ladies and gentlemen, midwives, let me remind you again who Dr. Jemima, Dr. Jemima Dennis Andre is a global public health profession, a midwife, a general nurse, and a health system leader with over 38 years of experience in advancing maternal, newborn, and women's health across Africa and globally. She currently serves as the founding president and the CEO of the Center of Health Development and Research, advancing health system strengthening, workforce development, women's health, and continuing professional education. Ladies and gentlemen, we are really honored. Thank you so much, Dr. Jemima, for such words to remind us to say, where are the midwives in Africa? And you also gave us, you also shared with us the opportunities, and you also shared with us the challenges that we are currently experiencing. But one thing that I took from your talk is that you also shared with us the opportunities that are currently there for us early career midwives, where you talk about the ICM mentorship program, where you're talking about the very nursing now challenge, program that is out there that is really assisting early career midwives and giving them opportunities. And you also have urged us to take positions, at the table. It's about time that we bring our chairs to the table because we won't be called, but it's about time that we sit on the tables of policy making and policy decisions. And lastly, I liked when you talked about retention is not optional, but a matter of social justice. Thank you, thank you, thank you so much, Dr. Jemima. I think all the midwives within the African region, we have heard there is a need to retain our midwives within Africa. But again, there is a call to Africa to create those opportunities for us as well. Thank you so much. We really appreciate. We are going to move over to, please feel free to write your questions, or we're going to have a Q&A towards the end of the webinar. So please feel free to write your comments or write your questions there. So we will move to Ms. Harriet Naiga, who is a founding director of the midwife-led community transformation Milcot. She will share with us, as a midwife on the ground, the midwife perspective and the lived experiences. Over to you, Ms. Harriet. Thank you so much.
Thank you very much, Dr. Maureen, for this wonderful opportunity. I want to wish everyone happy International Midwives Day. I'm really, really honored that we are celebrating it together on this webinar. I really liked the minute where Dr. Jamima was sharing about midwifery in Africa, and then she was asking where are the midwives in Africa. So as I do share my part, I want to say that as a midwife in Africa, I am here. And let me introduce myself. My name is Harriet Naiga, a degree midwife and a specialist in sexual and reproductive healthy policy and programming. I'm a champion of Nursing Now Challenge. I'm also an alumni member of International Confederation of Midwives in the Young Midwife Leaders program. I would say that I am one of the midwives who have got the opportunity to be supported and show the world that when midwives are supported, they can deliver. I'm the founding director of Midwife-led Community Transformation, which is a midwife-led mode of care that I established to bring midwifery services closer to the community through preventive initiatives with the focus on marginalized adolescents and young adults. We do provide sexual and reproductive health information and services. We provide mental health. We do develop their economic resilience, as well as build the capacity of midwives in leadership, as well as in provision of adolescent-friendly sexual and reproductive health services. As I said, that I'm one of the midwives who have got the opportunity to be supported through the support of a number of partners. I have been able to establish in the community, because it is where I saw the problem and it is where the midwives are mostly needed. I am currently running Milcott General Clinic, which we established with the support of VACA Health Foundation, an organization that develops healthcare in Africa, supporting health workers in Africa. And I've been privileged to be one of them that they support to establish this clinic. And it's through this clinic that I have continued to see the evidence that midwives are very, very critical in healthcare system. I would give real examples and experiences that I have gone through. And I keep advocating to the world, to the global funders, to the global stakeholders that please, where are you? We are the best buy. Of recent, I write blogs. Of recent, I wrote a blog of a woman whom I cared for. She came with a story that she had lost her baby. In her tale, she said that she went through antenatal care very well, but during birth, she realized that there was a delay to have her baby delivered. So when she delivered, she was told that the baby is not alive. And then she came to me crying. So she came from the other big hospital where she delivered from. And then she came to our midwife-led unit to find me, the midwife, to counsel her and also find a plan ahead. So I was able to provide mental health support to this young woman, and she was able to come out of it. It had even caused her blood pressure to go high. I treated it and prepared her for the next conception. She conceived, and I took care of her throughout antenatal. She delivered her baby very well, and she's happy with her baby. So I realized that because she said that I do not like now big hospitals, and I feel comfortable to be with you because the support you have given me as a midwife, I feel it's all that I needed, even on the first pregnancy, because the facility has everything, but then it didn't help me to have my baby alive. My baby was big. Perhaps I needed a cesarean section, but it wasn't detected earlier. So in this case, I just want to bring out the fact that a midwife is placed in the community, very close to people, very close to women. Here, when a woman gets a problem, she calls and she's able to access me at a very, very, in a very short period of time, even without making a long appointment. She's able to rush and come to me, and I solve her problems. And we are having many midwives in the country, but we have the staffing gap of midwifery is at 36%, which is really high, on over 189 deaths per 100,000 live births. That is maternal mortality rate, which is still high, with the large number of midwives who have been trained but not employed, yet the women are lacking the services. And that is very, very critical, that we need these midwives to be employed. I will say that I believe the governments in Africa are aware that midwives play a very critical role, but priority. They have not yet put midwifery as a priority to say that let's increase investment into midwifery, because we are the ones who are closer to community. We are the ones who are serving the women. We are treating them. So I strongly feel that governments just need to prick them a bit so that they wake up and see the important role of midwives, so that they can increase investment, and also proper planning. There's a lot to do perhaps with the policies, so that policies allow midwives to practice to their full potential. Because I have seen in the communities that I serve, I have just found out that midwives handle women and children with confidence, total confidence. I'm telling you, like, we own our mothers, we own our babies, and we care for them fully. So then, why don't we receive this support that we need to take care of these women who are everywhere? In rural communities, we are having women who are not receiving services, who are not being listened to. They have mental health challenges. Midwives are within the same communities, perhaps running midwife-led clinics. But unless they are supported, they will not practice to their full potential. They will not deliver evidence-based practice. Because myself having a master's in sexual and reproductive health policy and programming has helped me to design these projects and then implement them, but also to see the society in a different lens, that I am able to diagnose this community and be able to plan and deliver what suits their needs. So I strongly feel that advancement in midwifery is very important, so that these midwives can practice with pride. The pride that I am having, many midwives need it. Many midwives need it, so that they can help support our countries and lower maternal mortality deaths. So I just want to close this sharing by saying that we have really made good noise about supporting midwifery. I just want to say that midwife-led models of care are really excellent in tackling community problems. So I send my voice to governments, the government of Uganda, governments in Africa, that they can look at midwifery models of care and increase investment into them, because we can really support communities. I want to thank you again for giving me this wonderful opportunity to share my lived example through midwife-led community transformation. Thank you so much. Have a nice time in the rest of your program. Thank you.
Thank you so much, Miss Harriet, for such an insightful talk that you've given us about the experiences, the lived experiences that you have went through. And you are saying, where are the midwives? I just want each and every one of us, wherever we are, to just answer this question that was raised by Dr. Jemima and also Miss Harriet, and say, when we are asking, where are the midwives? Wherever you are, just say, I am here. Wherever you are, just say, I am here. and just say 1 more million midwives. That is what we need. 1 more million midwives. And I think government policies, Ministry of Health, higher education, the health institutions, they have heard our call, or what you have indicated, Ms. Harriet, to say there is a need for investments in midwifery model of care, looking into the continuity of care. So that is one thing that we are really, advocating that such should be implemented across the African region. Thank you, thank you, thank you so much for your words of inspiration. I am here and 1 more midwives. Thank you, thank you, thank you. We are moving over to the Midwives in Focus, which is an initiative um, which is an initiative to challenge the perspectives and increase the value placed upon the midwifery profession that is led by Dr. Sally Pizarro and Ms. Gela Zabif, Center for Healthcare Research, Coventry University, and also it is part of the Nursing Now Challenge. We are here to hear about Midwives in Focus from Dr. Sally and Ms. Gila. Over to you.
Thank you very much, Maureen.
Thank you.
Really great to hear the speakers so far. I realise we've only got about just over 10 minutes left, and I know there's probably going to be some questions, but I'll just do a quick rundown of the Midwives in Focus initiative, which I've been kind of leading over the last few years, which has been amazing because we've been able to work with midwives all over the world to think about some really big challenges and topics in midwifery. And two of the things that we've been able to do are look at professional identity in midwifery and to look at leadership in midwifery as well. And we've done two big global studies, more than 70 countries included in both studies, including lots in Africa region, which is amazing. And we've been able to talk to people in those regions and beyond to think about the big challenges in midwifery. And one thing I'm going to ask in the chat, one of our papers that we published was looking at who has the stronger professional identity. Is it midwives or is it nurse midwives around the world? So just put in the chat, when we measured professional identity among midwives and nurse midwives, who do you think had the highest professional identity? Was it midwives or nurse midwives? So put that in the chat and I'll give the answer in a bit. And then the second thing I want you to think about is, what does strong leadership look like? So the ICM has been talking about strong leadership. And we know that, yes, we need 1 million more midwives, but we also need them to be well supported. We need to lead them, grow them, and make sure they have a strong, happy, and healthy career. So there's been lots of talk about strong midwifery leadership and the need for that. So one of the studies we did was ask people all around the world to think about, what does strong midwifery leadership look like? And we had 10 characteristics that we narrowed it down to, and we published those in a paper so that other people can kind of either model themselves on those 10 characteristics of strong midwifery leadership, or look at how their programs are developing those types of leaders we want, those compassionate, strong leadership roles that we need to take the profession forward. So we can post the papers. I'm sure we can get some links out to everybody so that they're free and open access to read. But that was as a result of Midwives in Focus coming together with other midwives around the world, thinking about what the key challenges were for midwives. And then we were pulling together ideas from all around the world, like I said, plus 70 plus countries, thinking about how midwives' professional identity is either stronger or can be strengthened, and thinking about what strong midwifery leadership looks like. So I'll hand over, or Gila's posting them in the chat. Thank you, Gila, in the background. I was going to hand over to Gila when she's done these postings, because Gila might have some more to say about the initiatives we've done and the research we've done and why it's important. I mean, these papers have been used by the ICM in their leadership program. So the leadership program that's happening at the moment, those papers and those 10 key characteristics of midwifery leaders have been used there. And also the ICM has tried to use our paper to think about why midwives are separate from nurses, why they might be a separate profession and why they need to be pulled apart more. It's not always possible in all regions, as I understand, but why we are our own profession is really, really important. So thank you, Gila, for posting those in the chat. Please read and use in your own areas. Let us know how they're helping you in your practice to think about the future of the midwifery profession. I'm going to hand over to Gila, and then when Gila's finished, I'll tell you the answer to the question. Although if you read those papers, you'll find out the answer, and you'll be cheating. But it's interesting to think about what people think's the answer, and then what the actual answer is, and that's how we challenge ourselves. So Gila, do you want to say something about these papers and how people have been using them from your perspective?
Absolutely. And thank you to such an esteemed panel. And I won't take up so much time because I really mostly want to hear the questions that everybody has from the participants. But I will say that these papers have been absolutely first of their kind in putting midwives on the map, not just in terms of that, as Dr. Maureen said so eloquently, where are we? Where are the midwives? Not just that we're saying we're here, but that we're a distinct profession with our own identity, autonomy, independence, and scope. And we talk a lot about the evidence that supports midwives and the need for 1 million more midwives. And all those things are crucial, as this incredible panel has already stated. But the question we need to ask is, when we get those million midwives, we need to ensure that they're acting with full autonomy, scope, and independence in order to save millions of lives across the globe. So thank you so much to everybody. Please read the articles, reach out to us at Midwives in Focus. We'd love to hear your feedback and your thoughts. The stronger we are when we work together, the more impact we can have. So thank you everybody for this opportunity, and happy International Day of the Midwife.
Thanks very much, Gila. Yeah, happy International Day of the Midwife to everybody. It's amazing to see so many of you here today. And, we're really pleased to be able to do the Midwives in Focus work and include as many people as we can around the world in that work, because I know different countries have their kind of segregated ideas about what's right for them. And of course, there's always a contextual knowledge to be garnered. But I think unifying ourselves as a profession across the globe is a really exciting thing that we can be doing. So in answer to the question I asked before, it was nurse midwives who had a higher professional identity score than midwives. So we've got some work to do in terms of thinking about who we are, what we're doing, and where we're going in the future. And I think it's an exciting time for midwives to think about that. We can't go backwards, we have to go forwards, and there's lots of challenges ahead. And we won't stop with Midwives in Focus thinking about those challenges with Nursing Now Challenge. So over to some questions, if there are any, for our wonderful speakers and panelists. Thank you so much to you all. It's been so interesting listening to you from your own contexts. So yeah, post any questions in the chat you've got, and we'll pick them up as best we can. We've got about 7 minutes left to pick up those questions.
Thank you so much, Dr. Sally. Thank you, Gila. Thank you, Midwives in Focus. We really need midwives to be supported. And we thank you. We will look at the papers that are supporting, that are indicating how midwives can be supported, especially in leadership. So thank you so much. In the chat, I can see we have Ghana represented, UAE, South Africa, Kenya, Lebanon, Senegal, Malawi. We really, really, really appreciate everyone that has joined. Let us move over to our early career midwife, Messi Maine. She will just take one question from the Q&A. Thank you so much. Over to you, Messi.
Thank you. Good afternoon, everyone. My name is Mercy Maina, a nursing and midwifery student in Chuka University in Kenya, and I'm the moderator, but unfortunately my Q&A is not working. However, I have one question to Dr. Jemima Dennis Antwi. You've talked about burnout, and we all know that burnout is a growing concern. What practical steps can institutions take to support midwives' mental and emotional well-being overall?
Can I go ahead to answer, or I need to wait?
Yes. Thank you so much.
Okay. Thank you very much, my dear future leader and midwife, for this important question. Yes, in terms of burnout is as a result of workload and as a result of stress. And most often it is because, again, it boils down to the issue of fewer midwives for so much work. I believe that if there is work overload, it is important that the midwives make their supervisors aware of this. And collectively, as a department, there is a need to look at how do you re-strategize and re-apportion the work that needs to be done. Does somebody need to be recalled from leave, maybe to balance out, instead of spending maybe your 30 days leave, can you take 15 and take 15 later on? Also, most of the time as midwives and as midwife leaders, we hardly bring our needs to management. And this is where advocacy comes in so importantly, that as a midwife leader, as a departmental head, as a midwife in charge, do not swallow all the responsibility. Let your supervisors know and move it to the next level and the next level until your voice is heard. And this is where advocacy comes in. This is where writing your need means, and this is where making sure that you seek audience with your supervisors counts. And then in terms of managing your stress, you need to look at, can exercise help me? Can reading a storybook help me? When I get off duty, what can you do to relieve your stress before the next time on duty? Share your issues also with family so that they can help you where necessary. Thank you.
Thank you so much, Dr. Jemima. I think we have 2 minutes. I'm not sure if we can take this quick, but just to say it from Dr. Sanele, she says, in a continent where older midwives can sometimes not be very welcoming to younger midwives, why have you always been so different and so embracing of us young leaders? So there is a question from Dr. Sanele, but I'm not sure if you can in 1 minute, but I would just also
I'll do
ask
it in
that
1 minute.
we all
Yes.
open our camera
I think
so that if we're ending, we can just have a picture for our International Day of the Midwife. Let us all open our camera. Dr. Jemima,
yes.
why are young
So
midwives not supported? Thank you.
I do so because I believe that the task is great and there is so much work to be done. Another reason also is because I believe that the midwife has so much potential, but unfortunately, few are able to see the potential and to move in there. So, as best as possible, when I come across, I want to encourage, I want to motivate, and I want to share my experience so that they can also be better leaders in future. Thank you.
Thank you so much. Are all your videos open? Happy International Day of the Midwife. Let us all say
Thank you.
1 million more midwives.
1 million
1
more
million
midwives.
More midwives. Where are you, midwives? Just say whichever country you are. Or
Nigeria.
let
For medium
Here.
midwives.
I am
Ghana.
here in South Africa. Thank you, thank you.
Thank
Thank you
you.
so much.
Thank
Hannah, do
you.
we have a
Bye-bye.
picture? For all of us, happy International Day of the Midwife. We can
Thank
continue the
you.
conversations outside, but I really
you.
appreciate. Thank you, Nursing Now Challenge, Dr.
Thank
Sally,
you.
Dr. Jemima, Miss Gila, Dr. Pizarro, Mercy, Sanele, Zipporah, everyone, all midwives across Africa. Happy International Day of the Midwife.
Thank
Thank
you.
you.
Thank
Bye-bye.
you. Thank you.
Bye.
Bye-bye.
Thank you.
Bye.
Namaste.